And then I hold my breath as I try and get ready to share the screen for the presentation.
Oh, here I am.
Are you seeing my screen?
Yes.
Yeah.
Great stuff. Okay, here we go then. So thanks ever so much for joining. This is a campaigning for change webinar to reflect the fact that we're heading towards a general election, and we are going to talk about how we might, what we've been up to. A lot of you will know quite a bit of that, of course, already, and what we're planning to do in the run up to the general election, and a little bit about what we'll do afterwards. I am going to talk for 15 or so minutes, and I hope most of you know me, but my name's Hugh Adams. I've been at the charity for a number of years, and my current role is Head of Stakeholder Relations. I'll be then followed by my colleague, Thomas Brayford, who's our Public Affairs Manager. He'll look more at what we can actually do in the run-up to the election. And then we'll hear from David Beamer, who is the Managing Director of Brayford Consulting, who work with us in terms of providing public affairs just strategic support. And we'll be asking him a bit about working with us and also some thoughts on the wider political picture at the moment. And let's go. Just tell me if you can see my next screen now, and then have I swapped screens for you?
Yeah.
Yeah.
Thank you very much. Okay, so research, brain tumor research. There are two types of research. There's the research that we fund, which you all know about at our dedicated research centres. And there's the research that we don't fund, but that we can influence through our political and campaigning and lobbying activity. This is a slightly historic slide, but it shows some of the things that we've achieved, not this year, but the year before. So we've got the Pathway to a Cure inquiry report. That was conducted by the All-Party Parliamentary Group on Brain Tumours. Took evidence over a period of 18 months from across the board. We did a patient survey. We talked to scientists. We talked to clinicians. We talked to paediatric neuro-oncologists. We talked to industry. And we came up with the Pathway to a Cure, Breaking Down the Barriers report. And that has a number of recommendations that we're still trying to push through. And in fact, we're still awaiting an official response that was promised from government on this. And so we need to transfer that ask across to the next government. Much of this was put in play earlier. And Peter, obviously, I'm going to mention you here. When we had the 2016 petition that got over 100,000 signatures, and which led to George Freeman, who's pictured there holding his ministerial portfolio, speaking on behalf of the government at a Westminster Hall debate, calling for a task and finish report into brain tumour research, and that was chaired by Chris Whitty, and that published a fairly critical report of a previous policy. And in the wake of that, and at that time, as we moved on to 2018, and with Tessa Jowell's illness and subsequent passing, £40 million was made available for brain tumour research. Now, as we know, and as the APPG found out, still the position is around only 25% of that money has been spent. And I think that informed the APPG report, Breaking Down the Barriers on the Pathway to a Cure, and still does inform some of our campaigning. It still informs, it's still mentioned in that report, it was mentioned in our manifesto. It isn't the only game in town, but it's an exemplar of things not going as well as they could do. And finally, I wanted to show the slide before, which is Nikki Hopkins with her MP, Holly Mumby-Croft, who many of you again will know as a very active MP in the APPG, with the Prime Minister. And I wanted to just illustrate there again just how far we can take people on that campaigning route. Like many of you joining this, you've been thrown into this world unwillingly, not wishing to be a part of it. And Nikki was the same, and she spoke to us about going with her husband David over to Germany for treatment. Sadly, that treatment wasn't successful for David, and after he passed, she became a fervent campaigner. And working alongside us, we took her to Downing Street. So we really took her to the heart of of power. So that was sort of historic before this year started. Now, what we've done this year is launch our own manifesto. And it's been called "It's Time to Do Things Differently to Get Us Closer to a Brain Tumour Cure." And Dan Knowles, our new chief executive, or still feels new, Dan, although you've been in post for a good few months now, came up with a number of recommendations in that report that, again, are something that we take to government. We're talking about the response to the all-party parliamentary group report, declaring brain tumours a clinical priority. How are we going to spend that 40 million? Increased access to trials. All the things that we talk about in the weekly campaigning update are contained in this small pamphlet. And we took that to Westminster to launch it. And to do that, we actually had the company of the Health Minister, Andrew Stevenson, there. And he talked about the fact that actually it's a personal priority for him too. So following on from Will Quince, who'd been a health minister and had spoken about how much he wanted to make a difference, Andrew Stevenson says he wanted to make a difference. So what's next? Well, at this meeting, he invited Brain Tumour Research to join a round table alongside the NIHR with their chief scientist officer, and that roundtable has taken place. It was something of what my mother would have called a curate's egg. I think that's fair to say, and that there were some good bits and some bits that we weren't quite so sure about. But it was encouraging that we were at the heart of the debate and being asked to attend this meeting by the minister. And again, I think it was a very large demonstration of the fact that people want to support brain tumour research. The political will is there. And I think if I could get one thing across tonight amongst everything else, it's that we're not going to lose this momentum. Things that have been said can't be unsaid. It's a cross-party position on improving brain tumours because of the campaigning that we've done. The only thing that may change is there'll be some different personnel in place, and we need to work to build those relationships. So that's why it's so important that we get in contact with people now to say, this is what we'd like you to do. This is how you can engage with people, because we need to get them before they get the foot under a table somewhere else. And just to give you again an idea of the scope of what happened at Westminster when we launched our manifesto, that's Daisy Cooper, who's the deputy leader of the Lib Dems. And she is also their health spokesperson. She's also on the APPG. At that meeting, we had 3 current ministers, 2 former ministers, 19 MPs and 2 Lords. So there really is that political will and support there, and we've got to keep on tapping into it. And as another note, Daisy seems to be pretty much on brand with that suit as well. So that was extremely fortunate for those photographs. So moving on from that event, what have we been doing in the period since then, before the election was called? Well, here I am with Dr. Noble, Karen Noble, our Director of Research Policy and Innovation, at a meeting with Will Quince and George Freeman. So those 2 guys have had very recent ministerial experience, one in health, one in science. And George has been the Life Sciences Minister, or Minister for Science, for many years. Huge amounts of experience. And you'll see that is quite an informal situation. Dan was involved in this one as well down the line, and it was useful, beyond useful actually, because it was we engaged them in a way that they could just sort of free think about what would be the way forward outside of the ways that we might think of it. And it certainly offered up a huge amount of new and innovative thought that we can, again, is cross-party. We can take away and take forward. The other picture is me talking to Alex Norris, who is, I think, pretty likely to be involved with the health team at Labour going forward. Someone who we've spoken to a number of times, someone who's very keen, again, to move things forward for brain tumour patients and cancer in general. And so I think that hopefully shows that, we haven't been idle since the manifesto came out. We've been pushing forward, and we're looking forward to taking things even further forward, again, in the devolved nations, but things change. This is Thomas's area of expertise, the devolved nations. And as I say, things change. There is the leader who left fairly soon after that picture was taken. So people change, policies can change, but campaigning agendas and lobbying and what's recorded in things like Hansard aren't changeable. So you can go and take these arguments forward. I just want to really try and stress the fact that we're not going to lose this momentum. We just have to work a bit harder to make the new contacts. And so the last act, really, of the former Parliament was to get ready for the APPG AGM, and that's it taking place. They have changed the rules slightly around AGMs, and you need more people involved than you did before, and that's us in the very grand setting of the committee room 14, going through our official business to make sure that everything was above board and set ourselves up for another year as the APPG. You can see Derek Thomas, our chair, was there, Caroline Ansell, Lord Polak, Ian Stewart, Lord Carlisle, Mike Amesbury, Helen Hayes. A really good turnout. Holly was there too. We got everything passed, and then the next week the election was called. Now, what we can do, and hopefully people who've known and worked with the charity for a while will know, is that we've always been very fleet of foot. We've always been able to move things along very quickly. So we were very quick to get out of the blocks with election messaging when the election was called. We had a web page up the next day, and now we've got a sort of a suite of assets available for you as campaigners to access, and that's what Thomas is going to talk about in a minute. So that's our campaigning assets available on our website. So I'm just going to let a couple of people in because I've got a flashing message that said that. And then we're back to doing what we do best, and that, or what you do best. And I'm really pleased that both Matthew and Alison are on this call, because they've been out there with their prospective parliamentary candidates, getting the photographs, getting the pledge that the politicians, if they get to Westminster, will support our endeavour to get brain tumours declared a clinical priority, and get that pipeline funded. You know, fund from the early stage science, fund through the first in human trials, and get it through to the clinician's bench. It's really important that we do all of those things, all of the things that we bang on about day in, day out. We need to let politicians know that our case is still there, and they just need to be guided sometimes. I think that's one of the things that I've learned. They don't know this, they don't live this day in, day out. But if they hear something that they think that we are making a clear ask of what we want, why we want it, what it might look like, what they've got to do, then that's good and effective campaigning. And then that's what we've done, because the things that I've just been talking about demonstrate success and impact and cut through. It's not as fast as we want. Some of the things haven't happened as fast as we want. Some of the funding bodies aren't acting in a way that we think is amazingly well, it's slightly glacial at the speed that they operate, but it's got to be done. So I'm really proud of all of you for what you've done and what we're going to do. I'm going to hand over to Thomas now to talk a little bit more about what we are with our current asks of you as campaigners.
Hi everybody, thanks for that, Hugh. You gave a really nice overview of everything, and look forward to going into a little bit more detail about campaigning now. So I'm going to talk a little bit about how to engage with your local candidates in the general election. I come to this from a public affairs perspective, but I also worked for an MP for a number of years. One of the elections that I was involved in 2017, the MP that I worked for won by 30 votes. So it just goes to show that every vote in this matters. And probably people that he engaged with on the doorstep and responded to in the right way actually clinched him that election. So that's a nice illustration for you. Here's a quick overview of what I'm going to talk about. So I'm going to be talking about prospective parliamentary candidates, PPCs, what motivates candidates, engaging with them, and preparing for your meeting with your candidate. Next slide, please. Okay, so prospective parliamentary candidates, or PPCs, are the people who'll be standing in the general election, including your MP if they are standing again. Meeting with them means that you can get to know your PPC and build a relationship with them before they're in office. Candidates are elected to represent the interests and concerns of their constituents. Understanding these issues allows candidates to effectively advocate for policies and solutions that address the constituents' needs. Next slide, please. Most important question of all, really, is what motivates the candidates? So the first one I've listed is a constituency mandate. Basically, that the MP gets the support of the constituents. Also, an improved knowledge and understanding. This is where you come into it, basically. So if the candidates understand and get the issue, then they're more likely to do something about it. By understanding a constituent's issue, the candidate, when elected as an MP, can make informed decisions on legislative matters. It's important to build up that trust and to establish a relationship. Politicians also love a good opportunity for publicity. They love photo ops. They like to be signposted to ways in which they can help a campaign. Hugh talked a little bit about the manifesto before. I think a beautiful page of that manifesto, which basically distills everything we're asking for in the next Parliament, is the 6 achievable and impactful commitments that we are calling for. So in particular, that the government declares brain tumours a clinical priority, and that the candidate advocates for increased participation of adult and pediatric brain tumour patients in clinical trials. And of course, an elected representative wants to leave a legacy of public service. Let's remember the primary motivation of most people who want to become involved in politics at either a local or national level is the genuine desire to make things better and to make a difference. Next slide, please. There are different places where you may bump into your candidate. They could be canvassing your vote on the door, through street stalls, phone banking, or there could also be husting opportunities. From experience, there are usually about 3 or 4 hustings during a campaign. A thing to note with candidates, even if it's an MP that's standing again, is they'll be like a sponge. They'll want to soak things up and learn something new. If it's a long-standing candidate, somebody that's been an MP for a number of years, it's also a chance for them as well to re-engage. So don't assume that just because you've written to them that in the past that they already know about things. It's a new start for everyone, and an opportunity to engage with all candidates. Some tips here, how to approach that engagement. I've put for hustings, but this is like general engagement. Research, learn about your PPC's background, policy, and party manifesto. Prepare some questions, formulate clear questions on brain tumours and brain tumour research. If you attend in the hustings, make sure you attend early secure a good seat. My tip for you whenever I go to one of these things is to wear a flowery shirt so that I'm noticed, and so that the moderator does pick on me to ask a question. Familiarize yourself with the format too. Listen actively, pay attention to other questions and answers to avoid repetition. Also, your question may fit in with something that somebody else has asked. So that active listening demonstrates that, you know, these are the constituents' concerns, and that's linked to a previous question. And also engage respectively, frame questions in a constructive manner. Next slide, please. Okay, and then the last one is about meeting your candidate. So an agenda is a great thing to have to plan your meeting. So this could be an agenda just for you or one to share with them. Hugh, on the campaign website, that there is a toolkit that Hugh alluded to before, that there should be a copy of the manifesto. There is a letter template as well, which could be used if you're writing an email to one of the candidates. There's also a letter, some kind of template that you can incorporate into a letter to your local newspaper. There's lots of stuff there, so it's well worth checking out. But basically, it's important to engage with stuff about you. Candidates always like that personal story, how it relates to you, because after all, you're the most important person. You are the vote. That's what you represent. So in these opportunities that to engage, it's important to introduce yourself, the what, the why, and the how, and give an explanation of the issue. So this can be from personal experience, but also from your research. If you're familiar with the APPG report and the manifesto, there'll be nice little snippets. You know, that some of the issues that you may have experienced, or your friends, family, they may be common issues. So it helps to build that case. And also, very important, are SMART asks. So specific, measurable, achievable, relevant, and time-bound. It's important that when you leave your meeting with the candidate, that you've got some kind of commitment. And the two commitments that I talked about before, that you know, the government declares brain tumours a clinical priority, and that the candidate supports that, and also that the candidate advocates for increased participation in clinical trials, because we know that the more clinical trials we're doing, the more research we're doing, the better outcomes that we have for brain tumour patients. If you could get them to agree to sign up to those two things and pledge their support to those, that would be fantastic. And then if they do get elected, then that's your starting point. You've already made that inroads. And if they're unfortunate not to get elected, they could pop up somewhere else as well, as some in some other capacity, as a community leader or a counsellor, and you can use that interaction you've had with them as that starting point to make a difference and to create change. I'll leave it there.
Right, my darling.
Okay, thanks very much. Thanks, Thomas. I thought that was a really interesting point that you made there about engaging with people who may not actually end up at Westminster, but they will still have a role to play within the community as an influencer. And Phil, I also saw your question about questions to ask. Have a look at the website, and what we've got there is the template for the letter to PPCs. There is a fairly binary ask. Will you pledge to support this declaring of brain tumours as a clinical priority and advocate for the funding through the streams from scientist bench to patients bedside? What I'd like to do now is introduce David Beamer from Brevia Health. Brevia Health, David is the managing director of Brevia Health, and Brevia Health are going to be working with us, assisting us in our public affairs endeavours. David has a huge amount of experience. I hope he's happy to share his thoughts about working with us, what he knows about our cause already, his own personal connection to the cause, and perhaps some wider points about the political landscape. David, it's a fairly open one for you to have a go at, but we're very grateful to you for joining us.
That's a pleasure, and thank you for the introduction. Throughout, please, if there's any questions as well that you have for me, please do ask. I think I haven't got slides to go through. I like sort of having a conversation, so please feel free to ask any questions. Just following out, Hugh, from your ask. Brevia is a public affairs agency. We've been going now over 25 years, and we've got a really amazing senior health advisory board. It includes Gillian Lang, who was chief executive of NICE, and we've got MHRA experts and former Labour Party MPs as part of our advisory team. My personal background, I was an advisor under the John Major government. So I was doing health policy many years ago, and was advisor both in government and in opposition. So the coming challenge that I think every organisation is going to face is a transition based on where we are with the opinion polls of a transition from a Conservative to a Labour administration. And I'll talk in a few moments about some of the challenges that I think you'll see, but also some of the amazing opportunities as well, and how we can support you. So that's my background. I think in terms of my own experiences, so a very good friend of mine passed away in October 21. She was diagnosed literally sort of 18 months prior to that with she had terrible migraines, and she went in and the scans revealed a grade 4 glioblastoma. So you mentioned the treatment in Germany earlier, Hugh, in one of your conversations. So she also went over to Germany as well. So yeah, a very good friend, and we miss her greatly. So that's my own personal motivation to really support you, as well as what is a fantastic challenge. And I think in terms of what I've learned since I started working with you, so we were appointed at the beginning of June. And we have a 2-year mandate to support you, and we have 3 kind of principal areas of work. And the way that we support charities like yourself, we do at the start, we do what we call a prep work phase 1, which is really learning about you. So I've clearly learned more now from joining this call as well. So it's early days, but I think and from that early kind of learnings, as an organization, you are doing an incredible amount. I think the support that we can offer is, I think, the icing, because you're doing a lot of things right. But I see in our phase 1, we're learning about the all-party group and also the new cross-party group. So they're 2 fantastic vehicles. I appreciate there was a challenge of reforming the group, but I think you're very well placed when the new parliament starts up to reform the all-party group. And my own experiences is how I can support you. So I've been a secretary for a cross-party group, and I've also run the secretariat for over 5 all-party groups. So I've got some insights in terms of how potentially you can use the all-party group and the cross-party group, and in different ways. I think you've done a lot of things that I would do with an all-party group. I think the cross-party group is a great opportunity now. It's relatively new, so we can give you advice as to how to best utilize that. So in phase 1, it's really looking at the groups, looking at the coalitions that you're part of, And then I think timing wise is fantastic in that when we do our phase 1 work, we do a stakeholder map. Now, the great thing about where we are now is when we complete the stakeholder map, we'll have a whole new deck of parliamentarians in the UK Parliament, not just because of where the opinion polls are, but there's a lot of people leaving Parliament. You mentioned that Will Quince, he was a great minister in my view. And I think what is great from a fresh start in a way is that you've got a whole group of parliamentarians who will want to engage and want to find an issue that they can run with. And based on where we are now and the potential for a large Labour majority, there is going to be an awful lot of backbenchers who will want to find an issue to really champion. So one thing I'm keen to do is just identify and help Hugh and the team just identify who those individuals are. And then it's really looking at how best to engage. As I say, many of the things you're doing, the manifesto, the meeting at number 10, the all party group, all the things you're doing. And I think one of the things we did when we were seeking to work with you was to look at how you've used Parliament. And you can see the Brain Tumour Awareness Month as a vehicle to get publicity and parliamentary interest. Is an example of what can be done to get parliamentarians talking about the issue. But also you can see some of the other initiatives across the year that leads to kind of spikes in parliamentary activity. So everything that you can, that we can sort of identify as opportunities to work and develop not only your stakeholder contacts, but also how we can help shape some of the messages. So that's phase 1, the prep work. And then phase 2, which will be from week 6, so that's sort of from mid-July, includes 3 elements. So the first element is intelligence support. So it's really just giving insight on what is potentially going to drive where a future government might go, and that's who will be also, for example, some of the stakeholders. So it's really giving you an extra view as to things that we're seeing and my colleagues are seeing. The second element of phase 2 is really strategic work. I think this is where we all come into hopefully particular use for you all. I think we do clearly a kind of a process approach. We have a monthly meeting with Hugh, Thomas, and Karen as part of the advice, but also we're there to bounce ideas off. And I mentioned Gillian Lang, who headed up NICE, so she's also part of the strategic offer. And we have also a great, as I mentioned, a former MP, a former Labour MP who's on our team. So as I say, we've got these hopefully experienced hands, but also I've got a colleague, Iona, who will support me and help gather some of the insight. And then the last element is really helping you to engage with stakeholders. And I think this is really, are there any kind of particular tricks or angles? I think what Thomas said about how to work with candidates is really valuable. Clearly, if any of you have Wes Streeting as your local MP, even better. But there's clearly a lot of other junior shadow ministers in the Labour team that I think would be really beneficial. So I think we talked about the future as well now. So as I say, they're the services, but in terms of the future and where we're going, we are expecting a large Labour majority, and Wes Streeting, unless he makes an error for the last 3 weeks, will become the Labour Secretary of State for Health. And I think he has had his own personal experiences with cancer. It's well documented. A lot of politicians don't really like talking about illnesses that they have, but he's been very open, and he was quite frank as well about, even recently in terms of his concerns about whether he could get a scan fast enough for the NHS. So as an individual who's gone through his own cancer battle and survived and has had a recent scare as well, I think he's an individual that I think will be, very fresh. I think the challenge always with a Labour government, and my experiences nearly over the last 30 or so years, the challenge is that they can be very target orientated. And I think this is both good and bad, because sometimes targets can be easy to hit. So I think we just have to kind of look at where they're going to go with this approach. They've clearly pledged to double the number of scanners, but clearly then there are then challenges. Clearly you can do scans, but then it's the staff required to analyze those scans and get through point. So I think Wes is a very able politician. He's very close to Keir. He's one of those individuals that is very much at the forefront of the current Labour Party. And I think having him as Secretary of State, I think will be very beneficial to you. I think moving forward, the first 100 days of a Labour administration based on the previous Blair years is very important. So I think what I'm keen to do is to see if there's any quick wins that Brain Tumour Research can achieve in the first 100 days. But I think overall, it's great to be working with you. Timing wise, annoying clearly for many people, the election was brought forward, but from our point of view, actually, it's really good because we're working at the start of a new administration. And as I say, moving forward, you've done so much good work. And I say, hopefully we will just identify, as I say, the icing on the cake to take things forward and to get progress. So hopefully, Hugh, that covers everything you wanted me to cover. If there's anything else, please let me know.
That was it. That was exactly it, David. Thank you so much. So we can open up for questions now. Just pop your hand up and fire away. I was going to just say that David was talking about the new MPs coming to Westminster, and we do have a freshers strategy, if you like, an idea of engaging these new folks, and also following conversations with David and with George Freeman and Will Quince that I spoke about earlier. We're investigating what might be the quick wins, because I think the large funding announcements may not be so on the horizon. The smaller wins where we can actually lead the way and say, this is what we need you to do. This will look very good. This will look very good for you in your first 100 days. So that's certainly part of the strategy. David, if I could ask one thing though, before we take it to the floor. Again, we're talking a lot about health. What about roping in science to make sure that we're working to establish that pathway that I spoke about at the beginning, the pathway to a cure that goes from the bench to the bedside? Is that something that? What do you think about that as a way of pushing forward?
Yeah, I think it's a very good angle. I think it's the challenge, I think, clearly from a political point of view, is that the NHS is often sort of compartmentalized. It's almost like its own sort of part of government, and joining things up with other departments can actually be a really vital way of pushing things through. And also, clearly, the UK as a whole, is seen in some areas as being, having great leadership in science. So definitely, I think if there's an angle and pathways to go through, we should definitely use them. I think, as I say, the silo and the challenge of the NHS is that often it doesn't talk and go broader than a very sort of closed off department. So I think, yes, those angles are important, and I think you've clearly got experience with people like George and others on this.
Well, I know we mentioned in our reports about challenging this silo thinking, and I think to do that you have to think differently, as mentioned in the title of the manifesto. And I think you have to be a disruptor. And I'm glad that the disruptor in chief, Sue Farrington-Smith, has joined this call, because that's one of the things that's always pushed us forward, is not doing it the way that things have always been done. So I'm looking for hands to ask any questions you've got of myself or David, and it looks like a hand coming up from Sonia. Evening, Sonia. You just need to come off mute.
Yeah. Oh, hi everyone. Yeah. With regards to, obviously, I've been campaigning for been speaking to a lot of MPs and peers throughout the years, and I find that now, if we had guidance on actually very specific if there was something at that point in time that was really crucial to moving the dial, that if everyone was aware that campaigns and rights to their MPs or peers or have people involved could really target that specific need, it would really sort of highlight it. So maybe for 2 weeks or 3 weeks at a time, you highlight a specific issue that everybody really homes in on to really, because we get a lot of answers on Hansard, but sometimes they don't seem to be followed up, maybe in a almost like a fact check, you know, like with the vaccines in November, they'd said that childhood cancer and brain tumours seemed to be indicated twice that it was going to be included. And it's not till July when we realised actually, and it's too late to campaign and home in on that, and really that it wasn't, brain tumours weren't included. And it was a real disappointment, and I feel a real lost opportunity that we had from October, November to July to really, you know, to June now, sorry, to try and change that and to try and shout a bit more for why not, you know, why.
So, Sonia, I think that's if I might take that, I think that's a really good point about, you know, focusing down and having the lens on one particular issue. And I think one of the things I learned from a meeting we had with MND, and we know that the MND were in a similar situation to us at one point, where they had money that was made available for research funding that wasn't actually getting out of the door into the scientists' hands, was that when they had something, when Rob Burrow was on BBC Breakfast, they built stuff around that, so that at the same time that was going out on BBC Breakfast, MPs were getting bombarded with messages from their campaigners. So it felt like it was coming in from all sides. So I think that concerted effort is definitely something.
Yeah, because I was actually thinking that MND has managed to sort of get a bit, even though they've been shouting quite loud on particular issues, and I think if at the moment there's telephone, radio, chat shows with people like that people can call in and speak to hopefully future MPs or cabinet. I think even opportunities like that, I've tried to get through, but if you can get through onto these radio shows to ask about health questions and try to get a brain tumour question directly to someone, it's another way that, you know, sort of maybe do things a little bit differently as well with the campaigning, rather than just, because when you write to them, they just give you the same generic back in 2018, and if I get in one more letter saying that again, I'm gonna go mad.
Well, and we don't want that, Sonia. We don't.
No, because
Yeah.
I'm really getting to the point now. It's ridiculous that they keep quoting 6 years ago and not spent the money.
Yeah.
Sorry, I'm getting really angry now, but you
No.
know.
And just for people who don't know Sonia, she is the most remarkable force of nature and campaigning personality for brain tumour research. Gets extraordinary cut through and access to Lords and MPs. Thanks, Sonia. Sorry, Rebecca, were you wanting to ask?
Yes,
something?
I would like to say something because I've been listening and lip reading everybody. I'm profoundly deaf. I've been lip reading everything, listening to what's been said. And I need to let you all know that I cared for my father who had glioblastoma from September to November. It was very sudden. He was diagnosed. I cared for him and he passed away in my arms. And also my mother-in-law had glioblastoma as well. So there's two people. And there's a lot of theories about glioblastoma. What causes it? Is it the previous cancer? Is it radiation? It's a variety of things. But when I spoke to the consultant of my father before he passed away, they said it's just random. It's just like the dog. And that's why I feel so passionate. I'm doing a 2-mile swim on the 14th of September to raise money for your charity. And it means a lot to me. And I just want an answer. You know, what can we do to prevent and help?
Yes, I mean, I think, and Rebecca, as I said, we're hugely grateful for the swim that you're doing. You're right. The whole indiscriminate nature of the disease is something that we need to find out to raise awareness of that, because a lot of cancer strategy, and I'm sure David will agree with this, has been about putting it back to the population and mitigating risks of getting certain types of cancer through diet or lifestyle. And that we know that's not the case with brain tumours. And so if you don't know what causes something, it makes it a lot harder to understand,
Oh,
not just to prevent it, but how to treat it. So that definitely is very high on our agenda and something we use in our messaging. Is it Mark?
Yeah, I just wanted to address one thing David said earlier about having a target for a potential Labour government to aim for. In one of the meetings, John MacDonald mentioned something akin to a like brain tumour czar, somebody who could be part of an APG or government in particular, because of more power, who maybe the Labour Party could nominate as somebody who might help drive things through, because he did mention that this had happened before. And I wonder if is there any purchase in that? Is there anything that we can pursue in terms of that?
David, I don't know if you want me to have a go at that first, because obviously I know the territory a little bit easy. I mean, I think that's a really good point. There are a couple of Labour grandees who we have good relationships with. Actually, I mean, certainly one that Sonia opened the door to, that I think would have the necessary weight and reputation to do something like that. I think that we need to perhaps also then think about the role of an institute too, and the collaborative nature of bringing together other groups with us sort of at the forefront of it to take forward the wider agenda. So I think somewhere in between there that lies the answer. But I think that John's point was well made, and I do think that, I mean, I'm sure you know who I'm talking about. Sonia, but,
Yeah.
David.
Yeah, I think I think we clearly need to do our initial research, but I think from my own kind of campaigning work, having a champion, whether it's called a czar mark, or whether it's you call them a parliamentary champion, I think is clearly something that is really valuable. I think, going back to your point, Sonia, when you get letters, it is a typical tactic of ministers to regurgitate previous positions, and that's why having a champion who I would call them being a bit of a pain in the ass, somebody who's willing to keep championing and saying we're not prepared to get this answer again, you need to do something about it. And I think when you find that person, again, I need to work with Hugh and colleagues more over the coming weeks, but those individuals, if you've got them, are so valuable. And so I think, again, I said it's early days, but it's something that I will sit down with Hugh and colleagues to find those individuals that will go up to Wes Streeting when there's a vote going in the lobby, to actually say, look, we've had this letter again, and we're not going to accept it anymore.
Yeah.
So but that's very much, it's such a valuable thing to have those champions, definitely.
But and I'll come to Dan in a second, and he may remember from the conversation that we had with George Freeman. George Freeman's position was actually the most powerful advocate that you could have politically. Is not a politician; it's someone who's a highly respected scientist or clinician who can make your case. Because politicians are used to listening to politicians; they're not so used to listening to scientists and clinicians. Dan.
Thanks, Hugh, and thanks, Thomas and David as well. For those who don't know, I'm the CEO of Brain Tumour Research, so it's nice to see everyone here and to have all of the support and engagement. I've got a point and then a question. The thing I just wanted to reflect back on that question about czars or grandees. One of the advantages that Brain Tumour Research has in our influencing work is our relationship with the Tessa Jowell Brain Cancer Mission. And the strong belief there is that that body, which was set up as a convening body with ourselves as one of the sort of founders of that organization, and a funder, and continues to fund, is that the Tessa Jowell name is very powerful in British politics, and with as David has said, if you believe the opinion polls, the likely next Labour government. So I think that I just wanted to mention that for attendees on this call, just so that you understand that we've got that. that sort of route into the Labour Party as well, albeit through a third-party organisation. And then my question, and I don't know if it's for Hugh, David, or Thomas, but for those of us who do meet MPs, in the run-up to the three sort of time periods, the run-up to the election, the period immediately after the election, and then in the period of the Parliament over a longer term, what do you think activists, and I include myself in that role, you know, when I meet my MP or when somebody knocks on my door now, or when they're holding constituency meetings after the election or in the immediate time afterwards, what could we best do to help influence the agenda in that time period?
I don't want to hog this, but as I'm sort of aware of what we're going to try and do, Dan, shall I just go with that one first? I think, as outlined by Thomas, to begin with, this is really about engagement at the stage before the election happens, where you know, you can assume that PPCs are quite pliable in what they'll agree to support because they want something. When they get to Westminster, then I think I know we will have new assets available that will be available to our campaigners to send to your new MPs, and you'll, as some people who join this call, you'll know enough about our brand to know that it jumps out at people, and so we will be sending eye-catching material with binary direct asks for new MPs. And then the next thing will be further down the line, something not that much further down the line, but a little bit further down the line will be somewhere where we'll have a direct engagement with MPs. And we would like as many people to invite their MPs to attend and to join us as possible for that. Now, we know when we had the brain tumour debate last March that we managed to mobilise 500 people to contact their MPs directly. If we can do that again, we'll get those people into a room, we'll give them a piece of something or other and a glass of something or other and say, now this is the way that we're going to take things forward. Are you with us?
Can you send me information about this, than what you've just talked about to me? That's okay.
Rebecca, you've got the stuff for the pre-election
Right.
assets online. These things will come on stream afterwards, but you know, watch those videos that I put out on a Friday morning. It will all be there, all in good time, ready for you too.
Okay.
We've got 5 minutes, so Alison and then Sue.
Thank you, Hugh. I just want to get something off my chest, if I may. At one of the debates that I think it was on BBC One, held by Fiona Bruce, and Wes Streeting was on there. Does he realise the complexity of brain tumours? How many different types there are? How many different grades there are?
Again, I'm sure that David might have an idea of this. What I can tell you, Alison, is that when we put together our manifesto, the Labour team got in touch with us to produce because they wanted to have early eyes on our manifesto to then come up with a response and to brief their ministers about it. So he would have been very, very much been on that panel, seeing what was going on. And as I said, we also met up with Alex Norris, who was going to go along down the corridor to see Wes's team, because we were trying to get brain tumours in the manifesto. Now, we didn't manage to do it, but I think that, allied with the fact that his links with Tessa Jowell, means that he is aware of those things. That, but I think now he's aware, as I said earlier, it's about us being able to propose the solutions to him to actually take it forward. Because
he was talking about utilising doctors and nurses and utilising the surgeons and the ladies there nodding her head, utilising the doctors and nurses and using the equipment 7 days a week and doing surgeries and doing the scans and shortening the waiting lists and what have you. Well, I had a scan, and when I went in for my results 4 weeks later, it hadn't been reported on because there wasn't enough radiologists to do so. Now, that's just one hospital, and short-staffed with radiologists to read the scan. How many hospitals have we got in that position?
Well, that's
And
not. Yeah.
is
Sorry,
West Streeting going to suddenly recruit hundreds of radiologists? It takes 7 years to train a radiologist. Where's he going to get the money from to do that?
Well, I think that's one of the things that people could be hopeful for, that actually there could be some long-term planning that comes into place now with the way that we think things might be structured for the next few years. And what we also have to look at are quicker wins in terms of things like drug delivery and repurposing drug, both of those areas. But it's a complex brief indeed, Alison. Sue.
Hi everyone, sorry I missed the beginning, so I might be repeating things, but I just wanted to encourage everybody that meeting those prospective parliamentary candidates is really, really important. I met Derek when he was fighting Lib Dem in St Ives, November before he actually became appointed. And exactly as David was saying earlier, that kind of thing, that new MPs will be looking for something to do. So it really is important if you can get to meet your PPCs at this stage, even those that might not be your flavour, that you might not vote for yourself, but try and meet them and help out. And then the other thing, David, I don't know if you're helping the team with identifying those PPCs that have got a particular interest in research and life sciences, because at the moment we always talk about the NHS arm, but it's the life sciences that we really need to get them interested in it. So just some little thoughts from me.
Yeah, of course. Shall I just touch on that very quickly, Hugh?
Please.
Sue, thank you. I'm looking forward to working with you based on everything that Hugh has said. I think in terms of candidates, you're absolutely right. In terms of mapping particular candidates who are likely to become MPs, yes, absolutely. Our mapping will do that and identify them. We've clearly got candidates that we think will be really good advocates for you already, both on the NHS side, but also the life sciences side. So yes, that's something that's very much part of this early work that we're doing to support you.
Thank you so much, David. Thanks, Sue. That we are out of time now. Thank you so much for joining this webinar. Do keep up with what we're doing in terms of the Friday campaigning updates. As I mentioned, Rebecca, there will be new assets coming on stream. We're currently in this process of the next 2 weeks, getting in touch with prospective parliamentary candidates. Some of them will become MPs, and then we'll get after them. Some of them will become ministers. We'll get after them then as well. So we won't be stopping. As I say, the momentum isn't lost. It's just the faces will change. But we'll keep going. So thanks very much, everyone. And,
Thank you.
Thank
see you.
you. Thanks very much. Thank you.
Thank you
Hugh.
so much.
Bye-bye.
Thank you.
Bye.
Thanks,
Bye.
everyone.
All right.
Thanks,
Bye.
David.
Thank you.
Bye.
Bye.